So the Medicare annual enrollment period is the time of year where folks that are on Medicare have an opportunity to take a look at what coverage they're on today and make the decision around what is the right option for me for next year. So it runs from October 15th through December 7th, and it actually means that your coverage that you select during that period would be for the upcoming year, so starting in January of 2025. You know, the nice thing for Medicare beneficiaries is that there's several different options that they can choose from and a lot of tools and resources to help them in that decision process. And it really depends on what the individual needs are. You know, healthcare is very personal, and so it's looking at, what is an important budget element of, financially what you're looking for in terms of, spending for your healthcare. It's also looking at access, so what doctors, hospitals, providers that you're looking to have access to. Things that are really important to people also include prescription drugs. So what drugs are covered, where can I get them? Can I get them at a retail pharmacy or a mail order? So for example, with Cigna Medicare, our Medicare Advantage options offer both retail and mail order. So you can actually go into a retail pharmacy to fill those drugs, or you can also have them mailed directly to your home, which a lot of people that are on maintenance medications, those types of drugs that you take on a regular basis, find that very convenient. So when you think about the options though, and you're looking at what is the right fit for what fits my personal needs, folks should be looking at Medicare Advantage options, which are all inclusive with additional benefits that go above and beyond traditional Medicare. And the Medicare Advantage options can include things like transportation to and from a doctor's visit, or fitness programs to keep people healthy and vital in terms of their active lifestyle. They also include benefits, many of them include benefits like hearing, vision, dental. And from an affordability perspective, many of these plans are offered, including plans that Cigna offers, at no additional premium. So people find it very valuable and affordable. The other thing I would say is that there's some people that may profile or look at a Medicare supplement program. And a Medicare supplement, it takes traditional Medicare and helps kind of wrap some of those benefits that are not included or covered by Medicare in the traditional Medicare program. So it's a good way to help in terms of having access to a broad range of providers through a traditional Medicare access, as well as having coverage for some of those things that are not covered by Medicare, by traditional Medicare. Then the third element would be, prescription drug plans, which the prescription drug plans are actually a standalone prescription drug program. They can be coupled with traditional Medicare so that you have pharmacy coverage. They also can be coupled with a Medicare supplement. So there's really a few to look at. The main message here, though, is that people should really take the time, pause during this, enrollment period, and really decide what is the right fit for me for next year, taking into account what are the things that are really important for me as well. Many people find it really helpful because most of the Medicare Advantage plans include medical and comprehensive coverage, as well as prescription drugs. So many of them include both in one plan, which makes it very convenient. And then some of those added benefits, like I had mentioned, so folks are looking for things like transportation, caregiver services, hearing, where you can actually get devices for hearing care, vision, get glasses, exams, looking at things like even over-the-counter supplies as well, which may be covered under some of the plans. And what's nice about many of the Medicare Advantage plans, like what Cigna offers, as I mentioned, is the affordability, because we offer many plans that are no additional premium. We have some that even have a Medicare Part B give back to them, which makes them really attractive because it makes them a very affordable option. And really, when you're looking at them, though, as I had shared before, I like to think about the holistic view of the individual and think of what doctors I want to go see, what hospitals I want access to, and making sure that it's the benefits, the affordability, as well as having the access to the right providers I'm looking for as well. Sure. So the federal website is medicare.gov, and then the Cigna website is medicareinformation.com.